Feeling dry after menopause? Let's fix it. Vaginal dryness is one of the most common symptoms of menopause. It can feel like burning, it can feel like itching. It may feel like you have a urinary tract infection. It might burn when you pee, but it's actually just the tissue that's very, very dry. It can also cause pain with anything penetrating. You want to address vaginal dryness not only from an uncomfortableness point of view, but over time, vaginal dryness can also lead to repeated urinary tract infections because the tissue is so fragile and so thin, and it can break and bacteria can penetrate it. So what do you do when you have vaginal dryness? First is check that there's nothing else going on. Ask your doctor to make sure that you don't have some sort of STI or some other things that can cause the feeling of a dry vagina. But let's assume that that's what it is. You can use a vaginal moisturizer. There's moisturizers with hyaluronic acid that are like a suppository. I use something called Reverie from Bonafide, which I put in at night, and it's kind of a little gooey. It's a moisturizer inside the vagina. If you are on hormone replacement therapy, that can help. That's systemic hormone replacement therapy of estrogen and progesterone. Sometimes, which was my case, even with systemic hormone replacement therapy, I was still feeling vaginal dryness. So my doctor added vaginal topical vaginal estrogen. Whether or not you are on systemic hormone therapy is your friend. Multiple research studies have shown that it does not get in your system and it does not cause cancer. You put it on similarly, you put it on at night, or you can insert it like a suppository. That works to actually replenish the tissue, the collagen in the area, make it more lubricated, make it healthier. It helps with prevention of UTIs. It helps you have better orgasms. It helps with better lubrication. So vaginal estrogen, or estradiol, that's the actual hormone, is your friend. It's a great thing that every woman should be using because we all are susceptible to urinary tract infections as we age, and that is one of the biggest killers of women. The last thing I'm going to talk about are lubes. Lubes are things that you use in the moment when you are being penetrated. That will help make things slippery, but it's not going to lubricate the actual area. The final note I want to make is coconut oil, any kind of kitchen oil, olive oil. Be very careful if you're using a latex condom. It can break down the latex condom. Number two, over time, because there's buildup of these moisturizers, these coconut oils, these other kinds of oils, they can lead to more of the bacteria in the vaginal area. So you want to try to avoid those or use them very rarely, and try to stick with whether it's a vaginal moisturizer over the counter or a prescription vaginal estrogen.